Good morning, everyone. I am Eve Bird, Director of the Carter Center Mental Health Program. Thank you for joining us for the second day of the Rosalynn Carter Georgia Mental Health Forum. As we did yesterday, I'd like to start out with some quick housekeeping reminders. Please be sure to double check that your Zoom video is turned off and that you are muted until it is time to participate in the interactive activities. If you have questions during any of the panels, please add them to the chat. Anna Cunningham and Susan Wisnett with the Carter Center will continue to monitor that chat. It's important that we hear your questions. This event is being streamed on the Carter Center website currently. We will be recording this day, and it will be accessible on the Carter Center website in the week following this event. A reminder that we will have press joining us today. Also, a reminder that some of the topics may include sensitive contact. For confidential and free support, emotional support, you can call 866-399-8938, and we will post that number in the chat for you as well. The Carter Center is proud to be a partner of the MTV Mental Health Day of Action on May 19th today. This second annual Mental Health Action Day has more than 1,400 companies, brands, nonprofits, cultural leaders participating. The theme of connection encourages calls to action to address the surge of loneliness and isolation felt by millions during the pandemic. To participate in this day and share social media, you can visit mentalhealthactionday.org, and we'll also post that in the chat. And finally, we hope that you will continue to, we hope you will continue to share your experiences of the day and thoughts about the forum on social media using hashtag Georgia Mental Health. As many of you know, this has been a remarkable year for mental health in Georgia. To hear more about this, I'm going to hand things over to Helen Robinson, the Associate Director of Public Policy for the Carter Center Mental Health Program. Helen.
Thank you so much, Eve, and good morning, everyone. I am honored to be joined today by these leaders and advocates. Jeff Breedlove, Chief of Communications and Policy at the Georgia Council on Substance Abuse. Abdul Henderson, Executive Director, Mental Health America of Georgia. Kim Jones, Executive Director, National Alliance on Mental Illness of Georgia. And Kevin Tanner, Chair of the Georgia Behavioral Health Reform and Innovation Commission. As we all know, this is the year of mental health in Georgia, and the many bills that passed in the recent state legislative session prove it. And each of these bills has now been signed by the governor. For the very first time, for example, we will allow for psychiatric advance directives in Georgia so that someone can express his or her mental health care treatment preferences in advance of a crisis, much like you can currently do for physical health care. We are declassifying fentanyl test strips as drug paraphernalia so that they can be legally used in harm reduction strategies to prevent fatal overdose. We will ensure that prior authorization from an insurer to cover a medication for a chronic condition, including behavioral health conditions, will last for a year without you having to go back again and again for authorization. We will be providing for co-responder teams composed of peace officers and behavioral health professionals, and we'll be providing for proper training of team members. We will be ensuring that we get in Georgia our fair share of the opioid settlement funding, and we will be getting an initial allocation of $66 million within 90 days. Importantly, we are adding mental health and substance use to existing rules that prevent surprise billing in Georgia. And there will be a study committee on the Senate side of our state legislature on homelessness. And we know that many behavioral health advocates are going to follow the work of that study committee. In addition to these bills, the state legislature passed the Mental Health Parity Act, which, among other things, will ensure that our state, for the first time, enforces parity in insurance coverage for mental health and substance use treatment. Among other things, the act aligns Georgia law with the Federal Parity Act, and can we all say finally? It establishes requirements for insurers and CMOs to report on parity compliance, and very importantly, the Mental Health Parity Act included public insurance, not just the private insurance that is regulated by our state. We are increasing transparency for consumers to submit complaints of suspected parity violations. And we all know that once parity is enforced, it's going to improve our workforce shortage because our providers will be allocated fair reimbursement from insurance. In addition to the parity provisions for workforce, we are going to have loan cancellation for behavioral health providers. We're going to have a database of our behavioral health providers, including where they provide services, what type of services, and what insurance they take. And when you think about our youth mental health crisis, which was the theme of day one of this forum, the bill addresses that as well. One important element is it calls for a multi-agency treatment for children team to provide for state-level care coordination to ensure that kids with complex needs do not fall through the cracks of our system of care. And we know that this is an important element of family preservation, which is such a significant goal of Georgia at this time. Last but not least, it extends the Behavioral Health Commission to 2025. With that very brief overview of the many pieces of legislation that will expand access to care in our state that passed in the 2022 state legislative session, now we are going to go to our panelists. And as you are listening to their discussion, please place your questions into the chat box so that we can have a Q&A element at the end of the panel. So now I'm going to direct a question to each of our panelists, and then after they have answered, I would like to ask others on the panel to chime in. And our first question is going to go to Kim. Kim, what do Georgians need to know about the passage of the unprecedented Mental Health Parity Act, and what are the next steps for implementation?
Well, thank you, Helen and Eve, and thank you to Ms. Carter for holding this wonderful forum. I look forward to it every year, and I'm so excited to be here to talk about the passage of the Georgia Parity Act. I think what Georgia needs to know is that we are in the right direction, that our leaders, our governor, our lieutenant governor, our speaker of our house, and our legislators all showed us that they care about mental health and that mental health matters to them. And I think that is something just to appreciate and revel in, because they were so supportive. If you saw, it was a full vote on the House side and a full vote on the Senate side, which is historic on a 70+ bill. Not to mention, Helen, all the other bills that you mentioned. It was actually at this conference last year that I think we announced that 2022 was going to be the year for mental health. And I am so proud of the work that our legislators, our governor, our lieutenant governor, the Alleviation Commission did to make it the year for mental health. So I would also say to Georgians, this is just the beginning, and I'm going to let Kevin talk about next steps, and it's hard for me to be quiet, but this is just the beginning. There is more to come. And I hope that everybody, it's so important as we talk about mental health to take time to celebrate. And we need to be celebrating all year long. And I know we have an event in August to celebrate this year. And I hope everybody is going back to their own mental health communities and taking time to celebrate this, because it really is monumentous. We also need to take time to thank our legislators so they understand that we appreciate the work that they did. So when we talk about next steps in implementation, I think one of the things, and again, Kevin will talk to this, that implementation is a big part of what the Behavioral Health Reform and Innovation Commission will be doing next. But implementation is also on the shoulders as us as advocates. You know, we've passed a very large bill and for several agencies and departments up and help them do research and hold them accountable to make sure all of this gets implemented. And if you don't think that's important, or just we can't overlook that, because, for example, we had federal law implementing parity for over a decade. We had federal law implementing medical loss ratio, or what we like to call medical spend ratio, since 2017, I believe. So implementation and holding people accountable for making sure they implement this crucial work is incredibly important. So I think for next steps as advocates, making sure that we bring our presentations and speak to the 5 committees that the commission has, making sure they're aware of what we see is important and part of the implementation of everything that we passed, and also what new ideas each of us, or maybe not all of us, have a national organization where we have access to best practices around the country, but we also have access to what's working in our individual communities, or the concerns, what's not working to the individual committees, I think is so crucial, important, and a part of our role as advocates. So those are the things that I see as parity as the foundation. It was the cornerstone to what we needed to get done. When we have parity, we've changed the minds of how people think about mental health, which is important. You know, I've said before that parity in itself, the law is important, but the revolutionary change of paradigm of how we think is more important, because when our legislators think different about mental health, they will do different about mental health.
Thank you, Kim. And that word paradigm
So
shift. Thank you, Kim. And that concept of a paradigm shift is exactly what I witnessed at the state capitol. Would anyone else like to chime in on next steps for implementation before we move to the next question?
Yeah, I'll add something, Helen. I think this one of the things that we need to really look out for as this bill comes into implementation and becomes real to millions of Georgians across the state is that with the governor's signatures, that's not the end of the process. That's more of the beginning. As the regs start to get written by the agencies, we need to keep a very watchful eye on that process. Just because we were able to defeat the insurance lobby in the General Assembly does not mean that they will stop at their effort to try to weaken parity at the agency level. So we need to be very vigilant in ensuring that the parity language stays as strong as possible through the regulation process. The only thing I'll just say in addition to that is that this bill was transformational. It was the most comprehensive mental health reform bill ever passed in state history. I think that this bill will change people's lives. It will save lives, and it's going to do great things. And it's just the beginning and not the end. So thank you.
Thank you, Abdul. And I agree so much. Sometimes as advocates, we believe our work is done once a bill has passed, and that is where a lot of the public attention centers around, is the passage of legislation. But it is so much about following through with all of the state agencies that have responsibility to implement. Thank you so much to both of you. Our next question goes to Kevin Tanner. What is the role of Georgia's Behavioral Health Reform and Innovation Commission in keeping this momentum going in our year of mental health? And what are the commission's next steps?
Well, thank you. And I want to start out by thanking the group that's here, the group of advocates across Georgia. I'm looking across the screen and I see so many folks that I call friends, people who have been in the trenches in this fight for a long, long time. And I can tell you, we wouldn't be where we are today without the Carter Center and without each of you working extremely hard building. This didn't just occur in 2022. This has been work that's been going on by so many people that's listening today for a decade and longer, building up to accomplish what we were able to accomplish. So as chair of this commission, I get the opportunity to stand on the shoulders of some real giants in this area. And a lot of you are here today. So I think it's important to note that. The role of the commission, first of all, I think it's important for the commission to be a cheerleader for the advocacy community, a cheerleader for our efforts here in Georgia. And I think last year, Kim said she announced that this would be the year of mental health reform in Georgia. And I had told Kim and Helen and some others that I wanted to announce that we wanted this to be the decade of mental health reform. So we're not done. There's more work left to be done. Just like Abdul said, this is just the beginning. I think that one of the things the commission's going to do this year is it's going to hold the agencies accountable to make sure that they're implementing the bill with its intended, the way it was intended to be implemented. We're going to be having them testify before the commission and subcommittees of the commission, talking about implementation and what they're doing so that they know that the advocacy community is watching, the commission's watching, the governor's watching, other leaders are watching to make sure it's implemented correctly. We have a lot of next steps. I will tell you that Save the Date went out yesterday for June 9th for the next full commission meeting of the entire commission. We'll send out an agenda and the location here soon, but it's going to be held on June 9th, the afternoon of June 9th, probably starting at 1 o'clock. One of the things we're going to do at the commission meeting is recap the legislation, and we're going to be setting some goals for this year because it's our plan is to produce a report by the end of the year with legislative recommendations for next session. And our plan would be to have a major piece of legislation next session to continue our effort to continue to build on the momentum that was started this year by so many here today. One of the things we also want to be able to do is, you all know, House Bill 1013 also set up quite a few areas that we needed to study. Some of those dealt with transportation of getting people to mental health services. I was on the phone yesterday, and I want to give a shout out to Grant Thomas over at Health Strategies office. He has talked to me every week about things in House Bill 1013, and they're on it. They're working, identifying resources to do implementation, and they're kicking off the transportation study. He and Justice Boggs and myself had a call yesterday about that. The unified formulary, people who suffer from mental health issues know how important it is that we develop this unified formulary like other states have done. That is also directed in the bill for that to be studied. It would be our plan that we will have a solution ready for that by next legislative session. Justice Boggs is very focused on alternatives to incarceration for people who suffer. And that was also in the legislation authorizing the commission to take a deeper dive into that area. One of the biggest challenges for workforce is our reimbursement structure here in Georgia. We know it's low. The study's underway to compare that to other states. So we're going to take a look at that. And it's our plan to have some recommendations around that for next session, so that we're able to change that reimbursement structure, so that we're able to keep people practicing, people who want to take insurance, who want to take Medicaid, so that we can have the practitioners we need across Georgia. So a lot of work is going to be done this year. I encourage each of you to stay connected, go to our subcommittee meetings, stay engaged. I also will tell you that we'll have a few changes on our subcommittees that'll be sent out next week, just making sure that we're arranging our subcommittees where we have the right leaders in the right locations. We'll be making some tweaks and sending that out next week. We've got a dynamic group of leaders who are very knowledgeable, and we're excited about the work ahead. But again, it's not just the year, but it's the decade of mental health reform, and we're not done.
So much, Kevin. And I have to let everyone on this forum know how important this commission is. The reason that we have parity in Georgia, or we will have on July 1st when the bill is implemented, is because of the Behavioral Health Commission, their work with all the advocates, as Kevin began by thanking everyone, all of these participants in this meeting today. Because of your years of work feeding into this commission process, we will have parity in Georgia. So all of the other topics that are top of mind for you and that have even been listed out in the Mental Health Parity Act as next steps for this commission, this is our opportunity to continue this transformative change in our state. Our next question is to Abdul. Abdul, other states are now looking to learn from Georgia's success, and I have heard from some of them in passing this comprehensive bill. From your direct experience, and you were incredibly involved on the ground, raising awareness for the Mental Health Parity Act this year and for parity in general, what are some of your lessons learned?
Thank you, Helen, for that question. There's a few lessons learned from this experience, and one I would say is the importance of building coalitions. In the beginning, about a year ago today, when we all started on this journey together, our coalition started off with about 14 core groups through the Georgia Mental Health Policy Partnership, which the Carter Center, NAMI Georgia, Georgia Council on Substance Abuse, American Foundation of Suicide Prevention, and several other organizations are part of. We grew that coalition to 54 by the end of this legislative session. And within that coalition, I would say one of the biggest lessons learned is that you have to be intentional about creating your dream team, right? What I call it, your dream team of advocates, your dream team of legislators, and your dream team of community stakeholders. All those combined voices bring power to the conversation in order to move this type of omnibus legislation. I think the other big lesson learned is that everyone has value in this process. Leave egos at the door. That is critical because the cause is no bigger than one person. Our combined effort and understanding, our strengths, our weaknesses, where we can do better. That all happens collectively when we all work together in lockstep. I would say another lesson learned from this is, as we dealt with the General Assembly, is that you need your core group of advocates within that space. And through that, we were able to create a mental health caucus, a bipartisan bicameral caucus that was on the House, chaired by Representative Todd Jones and Greg Kennard and Senator Brian Strickland and Senator Kim Jackson in the Senate. Those voices helped us spread the word about mental health and substance use disorder in the General Assembly. Another important part, that's a lesson learned, is that you have to be willing to sacrifice through this process. Being able to give up time, resources, it's critically important because without the dedication, without the will, your net result is going to be zero, right? So that extra effort that we all did, it came at a cost to us personally, resource-wise, having to drive across state to participate in events. You have to be willing to put in that work. And then the last important lesson that I would like to share is that it's important on how you use data in this process. MHA National has a screening tool that provides affiliates across the country with very important data. And from the data that was shared with us was that 4 counties in Georgia ranked in the top 20 in the United States for suicidal ideation and severe depression. And so we use that data to strategically target particular areas where we went out where these issues were prevalent. And we started going and doing press conferences in those areas and bringing awareness. And I like to say when Jeff and I first began our campaign of going around and bring awareness, we started off with tripods and cell phones to do Facebook and Instagram Live. And just through that, doing those small events across the state, that helped grow our coalition and help spread the word. So using that data, right, to strategically make decisions is critically important to this type of effort. So thank you, Helen.
Helen, I'll chime into that too. I think that you got to give a shout out to this team that's on the panel with me today, Jeff and Abdul and Kim. They did a tremendous job. And again, it wasn't just during session, but speaking of session, I mean, they were there every single day. They were identifying where we had problems. They had their ear to the ground, listening out for concerns. Prior to the bill ever getting voting out of the House, they were meeting with senators every day and key senators having conversations. We were on the phone having follow-up conversations and strategizing on an everyday basis. I think that was extremely important to the success of this bill. I also think it was important that the fact that we were able to get the Speaker of the House to personally engage on this as a personal issue. Once he decided to carry the bill, I think I knew at that point that we were going to be successful. I knew that we were have changes, but it was his issue, his key issue. We were going to be successful. And I think when John King probably said it best at the press conference when he was asked by the press, what does the insurance companies think about this? And he said, well, the freight train's coming, so they better get on board or they're going to get run over. And I think really what that said is because of all the work this group had done for a decade, and because of the work the commission had done, we made it the cool thing. If you were not supportive of House Bill 1013, you were definitely an outsider looking in, and it became the in thing to be as involved in House Bill 1013. So thank you to my fellow panelists, because they had their hands in the pot, and they were in the trenches every single day with this.
Helen, thank you. I have an observation.
Yes.
First of all, thank you, Chairman Tanner, for those kind words. But I'd actually like to go back to Kevin Tanner's question. The very first victory, in my opinion, in this whole process occurred, and I think it's important to say that Kim and the other members of the commission, they're volunteers. I mean, they don't get like a paycheck. This is not a job. They're sacrificing from their businesses and their families and their lives to do this. And I think the very first victory was when COVID hit. And I say this every chance I get, including this one. Those Georgians, they could have easily said, this pandemic's here. We'll get back on track when COVID's over. We'll see you later. But they did not. All of them collectively and holistically kept meeting. Sure, they adjusted for COVID and they went virtual and they did all this stuff. But for a peer for whom this is important, I think that alone set the tone. And I want to just acknowledge that and thank all the members of the commission who did not let COVID be an excuse to delay the work. Because had they done that, we would not be on this meeting today talking about 1013. So to the chairman and to all the commission members and to the public who doesn't know maybe that they're not actually paid, they're not paid. They're doing this, probably losing money over the process and losing family time. And just thank you. That's one thing I wanted to say. But to this question, I think that lessons learned are volunteers are essential. They're the power behind the logos and the branding of the name. So you can have a Kim and an Abdul and a Jeff go down there all day long and we'll do a good job, or we'll try to do a good job. But when we reach out to grassroots in communities where representatives live and they represent, and when they hear from people in their constituencies, that's the power behind the work that's done in the Capitol. So one lesson I think is demonstrably true is those who are grassroots supporters, when you get that email from NAMI or that text from Mental Health America or that post from us, we need you to do it, and we need you to do it when we need you to do it, because it's their time, not our time. And that's so important to have that voice in communities across Georgia. The other two things is social media. I cannot, and I'll talk about it in a minute, but I can't stress enough how showing positive support for a piece of legislation and a cause and a policy on social media is very important. I think we did a good job of that. We've got to do better jobs in the future, but social media, we learned the value of that. And also the last one that I want to comment on, and we saw it play out, and it was kind of rare. Fellow Georgians who either deliberately or innocently misunderstood parts of the bill, they came down, they were taking over committee meeting rooms, they were saying stigmatizing words and doing stigmatizing posts, calling the speaker and members of the General Assembly and the three of us and others some pretty unprofessional, hateful names. And there was a moment in time where you had to decide if you can stand up to that kind of hate and weather the storm. And I think to Chairman Tanner's point, Speaker Ralston said it best here. He said the truth won. And we knew we had the truth on our side, but learning how to, when someone's in your face saying some pretty ugly things, not to quit, I think was a testament to all the organizations, the 54 ultimately that were behind this, to the commission itself, and to the members who were supporting this. And I think we learned how to stand up to hate, and I think that was a valuable lesson.
Very well said, Jeff. Thank you. And I think you've set us up very well for my question to you, which is how can advocates stay involved for the remainder of the year, or let's say the decade of mental health in Georgia? Give us our call to action, and then I'd like to hear from the others on that as well.
Sure. Let me start off. Kim Jones, it is the decade of mental health in Georgia. So I want everybody to know that. And that's important because, look, underlying all the policy and all the reports and all the studies, all the votes, all the meetings behind mental health and substance use disorder is still a stigma. That's still the most dangerous part of this policy. So we've got to break that stigma. That's our first call to action, is to be willing to remember this is the beginning of the beginning, not the end of the beginning. So for these bills, we have to redouble our efforts. And as Abdul said, we've got to make sure the agencies implement them correctly. So how do you do that? Well, practically the easiest way to do that, and I can tell you that these three organizations, the Georgia Council on Substance Abuse, Mental Health America, Georgia, and NAMI, we're all very active on social media, and we all check our social media messages. So if you're not involved with the group, one of these three groups or all these groups, get involved. And by involved, I mean just kind of sign up to say, I want to help your advocacy efforts. Send an email or send a message on the Facebook Messenger or any platform. And I know any of the three groups will put you in their advocacy system and alert you when we're doing things about this bill and other policy issues, some of those other 13 bills that passed. So it's really as simple as that. It's really as simple. The first step is reach out to one of these three groups and say, hey, I'd like to be involved. The second thing is, I know NAMI does it, and I know we do it. We will be doing free advocacy trainings around the state over the coming months between now and January. And again, if you reach out to any of the three groups, I know you'll get notified by email once those happen, but we'll be posting those on social media. They're free. I would encourage you to come to one of the advocacy trainings. I think that I know that we've had people that have been to those trainings that have come down to the General Assembly and worked on things like Narcan distribution. And it kind of builds your confidence up to know how to talk to a member of a commission or a senator or a representative. So come to an advocacy training that's free. I can't just enough to follow us all on social media, not just these three groups, but any group that's advocating for mental health or substance use disorder. Follow the members of the commission that have social media pages. Follow your own elected official, Democrat and Republican. Now, the very next thing that I think everybody should do once they get on social media is say two words: thank you. That's really the next step. I'm very proud that we were very strategic about when we flooded the General Assembly with emails and phone calls. And I can assure you it worked, because we got yelled at by a couple of people that we were shutting down their phone systems and their email systems. And that's fine. it was done collectively, and it was done with a scripted message, and it was done at a specific time. But just as we were willing to do that, we have to be willing to say thank you. And it's not too late to say thank you. So if you feel inclined, it was a unanimous vote in both chambers. So you don't even have to pick a particular person out. You can just thank the bipartisan support in this bill, which was truly historic. So say thank you on social media to the General Assembly, and look, to the governor. He signed the bill. He stopped, the speaker stopped, the lieutenant governor stopped, and I think we should not leave this forum without mentioning how historic it was. Chairman Tanner, I'm sure you, like me, probably can't remember a day where they stopped day 40, the last day of the session, for well over an hour to have a bill signing ceremony. And members of the General Assembly who had previously been arguing with each other just moments before stood shoulder to shoulder. They hugged, they cried, they said, "We got this right." And that bipartisanship, that symbolic standing there on the steps together, I think sent a powerful message that this was truly a bipartisan issue. Thank everybody for that. So the last thing I want to say is, go to those Behavioral Health and Innovation Commission meetings, whether they're virtual or in person, it's not even important. Just go to them. And I want to thank the chairman for this. They have encouraged, by the way, Mr. Chairman, I think you have done such a wonderful leadership job of inviting advocacy groups to be more involved as we move forward. And you're encouraged to send them your ideas, send them your policy ideas. And it doesn't mean they're going to do it, but it means it's going to get heard. And I genuinely believe as an advocate that the chairman and every member of the commission, and certainly every member of the commission I've had the privilege to meet, I believe they'll read those ideas, and I believe they'll take them into consideration. So send your ideas in now, this summer and this fall. Don't send them in the week after Christmas, right when the session's about to start, and go, "Hey, why isn't the whole world stopped and thinking about what I'm thinking about?" That's because the work's been going on. So this summer and this fall, this is the time to get involved. It's the time to ask for big picture policy things that you really care about. And the last thing that I'll yield is, make sure that you're going in person when you can to events in your local community, whether it's a Chamber of Commerce meeting, whether it's a Rotary meeting, whether it's a town hall by a local county or city elected official, your state rep, your state senator, or your federal member of Congress, or if one of the senators, U.S. senators, comes into town. And every time they have a public forum, somebody, the 99 people on this call, if you're on this call, you're a leader, right? And so you should be the person at the meeting that makes sure that when it's questions and answers time, a question's asked about mental health or substance use disorder, about this bill in particular. It could be as generic as, what's your stance on mental health and substance use disorder? Did you support 1013? Ask them anything to raise the topic when they are in your community having meetings. I love sidewalks and I love bikes and I love all that stuff, but the meetings don't have to just be about sidewalks and bikes. They can be about mental health and substance use disorder. So you can raise these questions and do it frequently. So I think, Helen, I'll yield there. And
Jeff, and you did a beautiful job of setting up our breakouts that'll be happening at the end of this session, because we are going to give all of these 100 people an opportunity to raise what they think the next big topic should be that are being addressed in Georgia, and we can feed that information back to all of you. So thank you for that. And please, anyone else on the panel, to the question of what can advocates do and what is our call to action to them?
I'd like to just add a couple of things, Helen. I'm trying to run through these really quickly, but one of the things, and Jeff hit on this, I think you need to keep the pressure up. Don't take your foot off the gas. It's so easy when we have such a large victory, because it was a huge win. Abdul hit on this. It's the most expansive bill ever passed in the Georgia General Assembly on this topic. I would say in the last couple of decades, it's one of the most important bills passed on any topic in the General Assembly. But we cannot just rest on that. We've got to keep the pressure up. I also encourage this group to build relationships with your legislators now. Meet your local legislators, build coalitions, in the communities where they live and the people who actually get to vote for them. Develop friendships and relationships with the legislators. Don't just wait to talk to them during session. When they see you at the Capitol, they need to know who you are. They need to know that you're there, that they are your representative, or they're your senator, and they're going to listen to you. Form emails, form phone calls don't work. Personal relationships work at the Capitol. It's important to remember that. Jeff also said, continue to offer ideas and suggestions. The commission wants to hear from you. No one person has every answer. This is a complicated, very difficult issue, and it has so many different parts. Each of you have expertise in certain areas. We need to hear from you. We have to all be in this together to find solutions. Jeff also said, don't wait until a week before. I also encourage you, don't wait until a bill is introduced to complain. You know, my fellow panelists here, they were involved in building House Bill 1013. That we were a part of that together. No one person drafted that legislation, but we always have a tendency, there's always a group or two that has a tendency to stand on the sidelines, not being part of the solution, but then throwing rocks at those who are. Don't be that way. This is too important to just complain. Be part of the solution, not part of the problem. Also, we said it earlier, I want to be able to hear everywhere I go, and within the next month or two, everybody talking about the decade of mental health reform. We need to spread that message all across Georgia. We also, our job over the next few years is for everyone here to be being invited all across the country to talk about how Georgia went from 51st to the best in providing mental health services. That's our goal. That's what we have to achieve. And I'm looking forward to those phone calls and having to turn some of them down because I got too many other things to do, wanting us to go to all parts of the country to say, here's how Georgia did it. We were dead last, and we went to being one of the #1 states in this nation for delivery of services. So that's the message we need to send. That's what I call utopia. That's what we need to be striving for. So I look forward to continuing to be a part of this with the Carter Center and all of these advocates, and the work's just getting started.
Yeah, and I would just like to add on the chairman's and Jeff's comments is that one of the most important things is follow what we're doing, as Jeff talked about, but also what we're doing, like the chairman said, don't stop the pressure. So immediately after session, Jeff, Kim, and I, so Georgia Council on Substance Abuse, Mental Health America, Georgia, and NAMI, Georgia, we have launched a statewide tour on what the Mental Health Parity Act does. And so, and part of that, and this goes to the implementation side, is that, you know, attend these sessions that we are having in your community, because we're inviting county leaders, county commissioners, your state rep, you know, your congressional rep's office, who attend. And part of these discussions, as we educate and bring awareness about what this bill does, it creates the discussion on how county officials are going to start to implement this, because it's just not the state. Like it's local governments that will be in charge of implementing many of portions of this bill, especially on AOT, the assisted outpatient treatment, the 1013 stuff. And those are very controversial issues, but in order to get it right, those conversations need to happen. And so, you know, as we do these events across the state, we encourage that you reach out to people that you know in those communities, or attend and bring someone yourself so you can be a part of those conversations. Because in the end, your voice is very strong. And as the chairman talked about how we have been all involved in the process, just because we're involved in the process, but what it really meant is that the community was involved in that process. Because since Kim's a member of the commission, and as she would ask us, like, the chairman's asking for this, how do you feel about this? We would go back to our stakeholders, right? And say, like, hey, how do you guys feel about this? And then you guys would provide feedback, and we'll give back to Kim, and Kim will get that to the chairman. And that's how this is supposed to work. This is what good governance looks like. And so I would say, just in terms of advocates staying involved, just follow what we do, participate, because like we said, like it is very rare that you have a 76-page bill that gets done in a 40-day legislative session with unanimous votes out of both chambers, out of the House and the Senate. So we need to continue to use that leverage, that momentum going into the next legislative session. It is going to be key to building on the foundation that we were able to create this year. So thank you.
Helen, just to Abdul's point about that tour, we had stops in May in Rome, Georgia, Cartersville, Athens. There would have been Lawrenceville, but that had a COVID curve. But we are working on dates in June and July already. In fact, we have the dates that we know the dates that match up, and we're working on the locations now. So you'll see a series of them in June and July for sure. I put my email in there if you want to know any of these. And also, if you have a location around the state that you might be interested in enduring the three of us talk for a little bit, all jokes aside, my phone number is there and my email. If you have a place and would like one of these conversations to occur, we would be very interested in talking to you and hearing from you, and very open to coming to your community. So contact me about that.
Thank you, Jeff. Kim, would you like to chime in on this one?
The only thing I was going to say, working with advocates over the years, what I have seen is that advocates are scared to do anything. It's a legislator. They feel very uncomfortable and maybe even intimidated by their legislator. And what I would like to remind everybody, that these are people that are your next door neighbors. They have to live in your district. They put on their, they get dressed every day just like we do. And so it doesn't have to be anything big. It can be a thank you note that you write in if you're, uncomfortable to be in front of somebody. Something we asked our members to do was to create a Zoom video. It's just hit record and tell your story and why mental health is important to you. Maybe you don't understand the policy. 1013, House Bill 1013, the Georgia Parity Act was a 70-page bill. Maybe that was overwhelming, but that doesn't really matter. What matters is that your legislator understands that mental health is important to you and how mental health impacts you. So I just wanted to share that to people on the call who maybe feel just uncomfortable, that it doesn't have to necessarily be about the bill in particular or anything, or there's other ways to interact that maybe you're not right in front of somebody if that's something that's uncomfortable for you.
Thank you, Kim. And I want to pick up on that a little bit, and also some of the things that Abdul and Kevin were saying, that it is possible that some of the folks on this forum right now may have experienced in the past our advocates not being at the table, not being invited to be at the table. Maybe they've had experiences that still resonate with them of being shown signs of stigma when they try to approach policymakers. So I want to acknowledge that may be very real for people, and part of the job of I think of this session and some of the things that Jeff was talking about going around the state is to help convince people that we are at the table. And so you can, with confidence, bring forward your story, bring forward your ask of what you would like the next big transformative change to be in this decade of mental health, because we've been accepted at the table, and that may be transformative just in and of itself for many people who've been doing this for years. But I've seen it directly, witnessed it. It is real, and it's a wonderful window of opportunity for all of us. Yes.
Before you end, I just want to give one more shout out to the Carter Center and to you and to Eve. We got down to really the end of the process, and we're running into some resistance with the insurance commissioner's office, getting a little bit of pushback. So we called a meeting with the insurance commissioner's attorney and some other folks. We brought the Carter Center in, we brought Helen, we brought Eve in to that meeting. and because of their experience with this parity conversation. And we negotiated some things out there in the conference room that day that everybody was agreeable to. And we looked at Helen, we looked at Eve, and we said, look, y'all have expertise in this area. Are you happy with this solution? Does this solution accomplish what our mission is? And we got the thumbs up from them, and that's what we went with. So I want to echo what you just said. We rely on the expertise of many people on this forum today to make sure we're heading in the right direction. So thank you to the Carter Center, specifically Helen and Eve, for being at that meeting and for being willing to listen and to engage in this conversation.
Thank you so much, Kevin. That means a tremendous deal to me, and we appreciated the opportunity again to be at that table, and that's really what it is all about. I think Kim sings that song the best when she just encourages all of us. Let's be at the table when these important conversations are happening. I encourage any participant to post in the chat if you have a question for our panelists. And while I'm waiting on that, I do have one that I will throw out to everyone. I think we've hit on this topic many times, but it is so important to Mrs. Carter and her legacy as an advocate for over 50 years for mental health. She has tirelessly worked to eliminate stigma. And, Kevin said earlier in one of his comments, that this became the cool thing to support. Now, that was not something I would have predicted a few years ago. And a couple of years ago, I had many people telling us when we would pull the Georgia Parity Collaborative together to meet, many people would say, you're not going to get people talking about parity. That's just, they don't want to talk about insurance. This is really technical. This is kind of boring. As Jeff said earlier, there's so much going on in the world. You really think that people are going to start talking parity? Well, here we are 2 years later. And we all saw many legislators and the Speaker of the House saying the term. It just rolled off the tongue, and they were comfortable and excited and energized about this concept of insurance treating mental health and substance use disorder equitably with physical health. And so that's quite a lesson learned for me. Is I'm glad we didn't listen to anyone who said no one wants to talk about this, because everybody did want to talk about it. What does that mean when it comes to eliminating stigma for behavioral health conditions in our state? Anybody can go first.
Helen, I want to say something about that, specifically about the speaker, and because I think you really hit on a good point, maybe without even really knowing it, and that is the more personal it becomes.
Yes.
Anytime you can relate to another human being on the emotional level, that's something they feel, they remember. We can talk about statistics and we can talk about facts all day long. People forget those things. But when we hit the emotional side of a conversation, they remember that. And I think for the speaker, his wife, Cherie, having a nephew who has mental health issues, who's serving a lengthy prison sentence because of things he did because of his mental health issue, that has made it very personal to him. So something that he might not have talked about 5 or 6 years ago, or might not have wanted to talk about 5 or 6 years ago, became personal in his own home and his life because of his wife and her experiences. And I think that's extremely important. So the more personalized we can make this to legislators and others, I think the more powerful of a message we have. And we saw that with the speaker. And you heard the speaker say, and I think he said this on the floor, is he had given up on fixing the mental health system. He just felt like this system is so broken that it cannot be fixed. And I think a lot of our advocacy community had even given up on really doing anything substantial. So I think what's happened in Georgia, and this is probably as important as anything in the bill, is there's hope. There's hope that's been restored to legislators, to people like the Speaker of the House, to the governor. I got a call this week from one of the governor's chief advisors with a conversation about mental health. They're talking about it because they recognize, you know what, we can really do something about this. We can really make improvements. This is not a mountain that we can't overcome. But again, I think hitting back to your point, personalize the message on the emotional side, and it is much more powerful.
Ellen, I get kind of emotional about this topic. I'm a peer, and I'm impacted by this, and I'm just one of over 1 million in our state with dual diagnosis, mental health and substance use disorder that are in recovery. And then there's my brothers and sisters who have not survived these issues. And when a city council member or a mayor or county commissioner or sheriff or a DA or a state rep and a state senator or a governor even talk about our issue, my message to them is you're saving lives. I mean, you are literally breaking down a stigma that people living today have experienced. This isn't historical. This is happening now. COVID impacted our communities disproportionately. Both mental health, medical cases, and substance use cases have risen and continue to rise as a result of COVID. Dr. Toomey called it the epidemic within the pandemic. We know that more people died of overdose last year than ever in our history, according to the CDC, and more Americans under 50 died of fentanyl than anything else last year. Those are just all part of the broader behavioral health epidemic. So I just, when the Carter Center has a forum like this, and you give peers and their family members a chance to communicate this policy issue, you're saving lives. And Chairman Tanner, when you and your commission members volunteer to talk about our issue. So this, look, I worked at the Senate for 7 years and I've worked in Congress, and I'll end with this point. There's a lot of important issues that matter to all of us in our daily lives. I mean, I staffed the Transportation Committee for 7 years. None of us like congestion. None of us like potholes. That's important policy work. But practically speaking, not every policy issue is about life and death, or about a family going bankrupt or not trying to get help for their loved one. This is. So when we elevate this issue and we break that stigma, we are saving lives. And the last observation for all of those elected officials and appointed officials, when our community shows up and ourselves proclaim that we care about it, that we've got their back, that we are talking about it at our Rotary Club, at our Little League game, at our church, in our communities, I'm here to tell you as a longtime staffer, it gives them the confidence to know that we're out there talking about it too. So it's so important that we talk about this, because it gives the elected officials the courage to know they're not alone. And so thank you all, especially the Carter Center, for giving us a forum to help break that stigma.
Helen, I saw a question in the chat box dealing with the infant question, and if it's okay, I'd like to just briefly answer that. I think that's a very good point. I think one of the things, and I will tell you, Gary McGivney, who's been a big part of our commission's work, who many of you know, he's a PhD psychologist, worked in the education field a long time. He's also a member of the Adolescent subcommittee on the commission. He's been a big champion of making sure that adolescents and all the way from infants through adulthood, we're not forgotten in this process. He's worked very hard in that area. We still have a lot of work to do in that area. But to answer the question, if you look at the bill, and you can go, if you've not read the bill, you can go to the Georgia House Representatives website, look up House Bill 1013. But specifically starting at line 1794, it talks about some of the people that the commission is going to convene or should convene to be able to address some issues around infant mental health issues. So that is definitely on the radar. We realize that we've got to address mental health issues at a very young age. We also realize we have significant mental health issues with our foster children in foster care. I think Candace is doing a good job over at that as director of that area, pushing. But one of the biggest challenges we face is two things. One is the siloing effect of our state agencies. They don't communicate with each other. That's a challenge. Centra did a report for the governor, and the two biggest things were siloing of the agencies. The second was lack of sharing of information. That's specifically a problem around foster care children, being able to get access to Medicaid information, to health information. So one of our goals this year is to tackle that issue and try to solve that riddle of how can we require that agencies share information about children and be able to get that information and those answers to the right people, especially when they're in foster care, that they need that information. So that's a big issue. We know it's a big issue. There's some language around line 1794 forward about that, but it is something we're going to be working on.
Thank you, Kevin. And I want to thank Gears for their work on that very important issue. They've advanced that significantly over the past years in our state. Kim?
Helen, I would like to make a comment to that as well. I think one of the things that I realized looking at infants in the bill and getting feedback was we do have legislators who do not believe that mental health impacts infants. Mm-hmm. So it's really important to us as parents who've had children with mental health conditions to educate legislators that things do show up at 9 months and 18 months that are indicators of mental health conditions. And we need to show them that with documentation and different kind of things to make sure that they are educated, because they may just not be aware of what's out there and how what research is already there and available to us. So that would just be another thing I'd like to add, is to make sure that we are educating them in that area, not only as Kevin said earlier with our personal stories, but include the research or a resource that can back up what we're saying so they can become informed about including infants in the work we do.
That's an excellent point, Kim, and it reminds me of the larger concept of parity, which is, we do understand infants have physical health, infants also have mental health. I want to leave us with some last comments from each of our panelists, and if anyone has a final question, I'll be scanning the chat, but maybe we'll start with Abdul if you want to just tell us what you'd like to close out with, and then we're going to move into some breakout rooms. So everyone, please stay tuned. We have some interactive work to do here in a minute. Abdul?
Yeah, I just want to thank Mrs. Carter, the Carter Center, Kim, Kevin, Jeff, Eve, Roland, who's not on here, I don't think, Andy, Linda, Madison, Miriam. These are some folks that were very instrumental in helping us get this bill done. This type of event doesn't happen often, and I'm glad to be a part of it. I'm glad that the community supported us. I'm glad that they showed up and showed out. I am very appreciative of this experience, and I look forward to working with everyone on the mental health reform bill 2.0, because that is going to get us to that next level of improving mental health and substance use disorder in the state.
Thank you, Abdul. Kim, I'll go to you next.
Yeah, I just echo Abdul's thanks, and especially to Kevin Tanner. I tell everybody, Kevin's got many hats and many other jobs. He doesn't have to do this, and we're so grateful that he had the passion and the leadership to take this on. I think what I see when I look back, and what I hope that we continue as advocacy groups, we got a unified vision for what needs to happen in Georgia, and then we stuck to a unified voice, and that is so powerful and key to what we are doing. We, as Abdul said, we put our egos aside. We focused, one of the key things that we focused on is what was best for the people we served. And when we focused on that, all the other stuff fell to the side. And I would just encourage us to continue to do that. As Kevin said, it's the decade of mental health. And we just need to help make it happen, as I say. Just keep up the great work.
Thank you so much, Kim. Jeff?
Well, let me also echo the thank you both to First Lady Carter, to Helen, to Eve, and the team at the Carter Center. These forums are wonderful and so helpful, and to Chairman Tanner and every member of the commission, and to every member of the General Assembly that voted unanimously for this particular bill. And it is the beginning of the beginning. It's not the end. And so we have a lot of work to do. Join the Mental Health Policy Partnership. Kim is our de facto leader of that, and it's a great group to be a part of to talk about policy. I'll just end with this. I am a peer. Somebody sent me a message in the chat about that, and I consider myself blessed to have survived a disease killing more people than anything else. And addiction and mental health issues, they're very real, but recovery is very real also. And if you take nothing else away from me today, I would like you to remember that recovery is real. And that's what I'll end with.
Thank you, Jeff. And Kevin, we'll let you close us out.
Well, first of all, thank you again to the Carter Center for putting this on and for all the work that you've done for so many years building up to this point. Thank you to the fellow panelists, a lot of the folks Abdul mentioned, and a lot of others that have been in the trenches who worked hard this session to make this happen. And echoing what Jeff said, this really is dedicated. The time that I spend on this personally, the time that these other members of the commission spend on this is dedicated to the people who are suffering from mental health and substance issues each and every day. The people who feel like they've been forgotten by the state of Georgia and by the departments and the agencies, and who feel like the bureaucracy has forgotten them and are more concerned about their protocols than they are about serving people. To that 9-year-old little girl who has mental health issues, is living in a nursing home instead of providing services that are needed. That's why we're doing the work that we're doing. It's work worth doing. People ask me, why do you get involved in these things? And I said, well, we get one shot at doing life. And there's a lot of things we can do in government. There's very few things that we can do in government that will have a generational effect on the future of our state. This is one of those things. I think it's probably the number one thing that we can do as a state is fix this system. So that's why I'm involved. I got a cousin who just got out of a mental health institute just a couple of weeks ago. All of us know people who suffer from this. We have to do better. Again, Kim hit on this. We're never going to agree on everything. Every group here has different opinions about different issues. What we can agree on, though, is the destination. And the destination is we have to continue to improve the system, not for the individual agencies we represent, not for our groups, not for our nonprofits, but for the people we're here representing, the people who are suffering from mental health and substance use. So I'm looking forward to continuing the work, and I'm looking forward to having a partnership with each and every one of you. And I'm looking forward to coming back a year from now and celebrating a new level of success. And the year after that, we got a lot to do, and I think we're going to make great strides. So thank you. And again, thank you, Helen, for moderating this great panel.
Thank you, Kevin. I'm inspired by each and every one of you. It means so much to the Carter Center Mental Health Program that you took time out of your morning to be here today with all of our participants. Thank you for everything that you do. And again, as Kevin just said, we'll meet here again next year, and we'll talk about our next transformational change that has happened in Georgia. You all may stay with us for breakout sessions, or if you have something you need to run off to, we totally understand that. And again, just thank you for being with us today. Everyone, please stay on. We are going to move into our breakout discussion. So now it is your turn to discuss continuing the year of mental health in Georgia. My colleague Anna is going to assign you to a breakout room. And we are going to have a 10-minute discussion with a staff person from the mental health program leading that discussion. We're going to be finding out from you, what do you think we need to be doing next in the year of mental health in Georgia? And your thoughts are going to be captured and given back to the leaders that you just heard from. So this will be an important conversation. And Anna, you can go ahead and begin to move people into their rooms, and then we will come back together to have a report out. Thank you, everyone.
Can you commit to take? For example, stay in contact with my own state legislators in their home districts now that the legislation is over, raise awareness among my networks about the parity legislation that will go into effect in July. Anyone have any quick final thoughts on that question? I like the idea of giving a lot of positive reinforcement to the legislators who helped enact this bill, and then encouraging them to continue to support this kind of work.
Amy, I think we're back in the general session.
Oh, we are. Okay. Thank you.
Welcome back, everyone. I hope you had a good discussion in your breakout rooms. And please remember to continue to stay with us today. We have another great panel coming up soon. But what we would like to do now, before we head into a little bit of a break, is to hear a report out about what we discussed. And we're going to make sure this information gets back to the leaders who sat with us during our first session this morning. So I'm going to go first. I had a great group. We talked about children. We think that the main focus for advocates and the commission coming up this year should be on children, including infants, as we discussed during our panel. And we talked about the importance of supports in schools. We heard some examples of some of the things that happen when a child has behavior that is potentially should be a flag that they need behavioral health supports, but instead they are experiencing punitive discipline because administrators at the school are not recognizing and understanding that that child needs supports, behavioral health supports. We also talked about accessibility, and this came up in the chat discussion during our panel session, that when you think about the Mental Health Parity Act and all the elements of it, we always need to be weaving in thoughts about how we can make sure that these resources, these new initiatives are accessible to all communities, thinking about transportation, thinking about language, cultural competence, and things like that. And finally, we talked a little bit about stigma and the idea that the brain is an organ, and we could actually talk about mental health as brain health, just like we talk about heart health, and continuing to break down the stigma. So those were our themes from my room. And now let me see if I can go to Amy Macklin.
Great. Thank you so much. We also had a wonderful group. The theme for us also was children and adolescents, and making sure we are providing support for middle school and high school students. But then we sort of thought too that it should start even before that. And one of the reasons is just because there's such a huge transition from high school to college, and if kids don't realize what's going on with themselves, they may not get the help they need as soon as they need it. So it can escalate before they know it. We also talked about workforce development, making sure that there are clinicians, especially in rural areas, that they are certified, that they have the training they need, that they can fill a lot of the same topics that have been on the table. But again, we want to reinforce those. Talking about understanding the needs of parents and caregivers and supporting children's mental health. So really taking the voices of parents and caregivers into account and listening to what they need and the kind of access they need. We also talked about school mental health services in schools and the role of APEX and expanding APEX. Expanding the workforce within schools, that the ratio of, say, counselors or social workers is too high, and we're doing a disservice to children if we don't have enough clinicians in schools. We had a great comment that this conversation is wide open. And even if something was covered in the recent bill, doesn't mean we're finished, and that it can't be continued to be fine-tuned and included in future bills. This first one was, he talked about it as being the foundation of the house, and that subsequent bills will be the completion of the house. And then we kind of ran out of time for number 3, but like I said, we had a great discussion.
Thank you, Amy. I love that quote about Bill being the foundation of the house. That is excellent. Thank you to your group. And now if I can call on Susan Wisnant to report.
Thank you. We also had a great discussion, and it was wide-ranging in the topics we covered. People were pleased that infant mental health is being discussed, and that is a topic that's going to need more and more focus. People are also interested in seeing neurodiverse populations covered, and especially autism. It was mentioned that once young adults are 18 or 21, there needs to be a continuation of those services. We discussed parity and reimbursement issues, and also adequate compensation for health professionals. It was brought up that people may be earning more at Amazon than they are providing mental health services, and that compensation is a big issue. We also discussed access and services for middle school students and younger, so following up on that children focus. Also discussed older adults and dementia, not only the caregivers, but also the older adults themselves, and just the tremendous impacts that those issues have on families. And again, we discussed workforce development. There are just a few psychiatrists being trained in Georgia who specialize in children's psychiatry, and the need to expand that.
Absolutely. Excellent, Susan. Thank you so much to your group.
Thank you.
Next to Michelle Rivera.
Thank you, everyone. So we were only able to talk about the first question, but we had a great discussion. So the two main topics we're talking about rural mental health services in rural Georgia and in prisons. So we had a lot of conversation about how in most rural areas, there's only about one psychiatrist that is there for a whole community, and they're only able to focus on anxiety and depression. But we're seeing a number of substance abuse cases coming up, and there aren't enough people that are trained in order to support these communities. Something else we talked about was stigma within the rural community in Georgia, and how we can go about breaking down the stigma and helping people realize to get support and help. Another thing we talked about was how the prisons become a de facto mental health area and support for people, but we tend to see that people don't get support until they commit a crime and they're admitted into a prison. But most of the time when they're in prisons, they're not able to get the adequate support that they need as far as speaking with the psychiatrist and getting on the correct medication. And we're also seeing that sheriffs are being bombarded with having to support people that are struggling with mental health issues that aren't trained to do so. We also talked about needing to work on the underlying issues and making sure that we're able to support all people. And then again, we talked a lot about reducing stigma and how there's also issues within people that are going to jail, but also within the family members that are sometimes also experiencing mental health issues that they aren't aware of and don't have support for. So we talked a lot about those two main things: support in rural Georgia, and then ensuring that prisons and jails are having more support for mental health issues in Georgia.
Excellent. So important. Thank you, Michelle, and to your group as well. And finally, we'll go to Eve Bird.
Hi, we had a great conversation. We felt that there needs to be raised awareness about how 1 in 10 of our Georgia citizens were not born in this country, and that we need to measure the needs of this growing kind of multicultural population that we have in Georgia, that so many people have even more limited access to services from lack of, because of language barriers or cultural barriers to care. There was a suggestion that there be focus on through the commission in creating through DBHDD a division of cultural equity or disparity prevention. I really like those two new names. They just seem very fitting. Also, we talked about a focus on really reimbursement for services and making certain that schools, regions know how to and can be reimbursed for mental health services that are provided within schools where close to where children are. I'll end at that.
Thank you, Eve, and everyone who participated. We'll be sending these themes back to our panelists. And now over to you, Eve, to send us to our next session.
Great. Well, thanks for everybody for participating in this last panel. It was just super great energy, a lot of action steps that we have identified. And as Helen said, we will make certain that all of your input gets brought back to these leaders and to the commission. At this time, we're going to take a 15-minute break. Our next, we're at 10:31, so we will start back at 10:45 promptly. Please come back. We have a great panel talking about the mental health needs of and need for caregiver supports really here in Georgia. Thank you and enjoy your break. Welcome back. Hope you had a good break. I am certain that in the last couple of years, each and every one of us in attendance today has experienced our role as caregivers like never before. Whether it is caregiving for an immediate family member, our friends, our colleagues, or our neighbors. And we must continue to exercise compassion and care when many of us individually and as a greater population as a whole is experiencing what I have come to refer to as lean emotional bandwidth. In our final conversation of the 26th Georgia Mental Health Forum, we will highlight caregivers across the lifespan, including the barriers they face and what Georgia is doing currently and what we can do better to address their needs. I want to remind you all that you can put your questions in the chat as during the panel. Now I'm pleased to introduce and have with us today Dr. Jennifer Olson, the Executive Director of the Rosalynn Carter Institute for Caregivers, Kathleen Cameron, Senior Director of the Center for Healthy Aging with the National Council on Aging, and Dr. Tony Miles, recently retired professor at the University of Georgia College of Public Health. I'm going to start by asking our panelists to tell us about themselves and explain their connection to caregiving, please. How about we start with you, Kathleen?
Great. Well, thank you so much, Eve. And I really appreciate the invitation to be part of the Georgia Mental Health Forum today. I'm Kathy Cameron. I'm the Senior Director for the Center for Healthy Aging at the National Council on Aging. I have a background in pharmacy. I'm trained as a pharmacist, also in public health, gerontology, and health policy. And I've been with NCOA for almost 8 years, and I oversee work related to supporting the aging public health, mental health network to implement evidence-based health promotion, disease prevention programs, and to sustain those programs. Many of them do focus on mental health and address the needs of caregivers. I also do a lot of work on policy and kind of serve as the bridge between our Center for Healthy Aging and our very active public policy and advocacy department at NCOA that does a lot of work on Capitol Hill. I have also been a caregiver myself to my late husband, who was a person with a significant disability, and also served as a caregiver long distance to my parents, who live many miles away, had lived many miles away. So again, thank you so much for the invitation to be part of this conversation today.
Thanks for joining us, Kathleen. Tony, welcome. So glad you're with us.
Thank you. Good morning.
Good morning.
Does it sound good?
Yes, it sounds great. You sound fabulous.
Wonderful.
So why don't you share with us more about yourself and then your connection to caregiving, please?
Okay. I am a physician, also trained in neuroscience, and shout out to Kathy at NCOA. I got my first ever grant as a medical student to study older adults and nutrition in Washington, D.C.
Yeah.
So NCOA has been a real force in my career, focusing on aging. I am connected to caregiving in a bunch of different ways. My parents live on a little farm out in northeastern Missouri, so all of us kids are surrounding them and caring for them. I supported my sister as she cared for her daughter with cerebral palsy for 25 years, which I think that circle is what enabled Regina to live as long as she has. And so now I spend a lot of time working on support through other means and policy initiatives, which you'll hear more about when I talk. So how's that?
That's great. Welcome. Hey, Jennifer, I'm going to turn it to you.
Hi there, Jennifer Olson, CEO of the Rosalynn Carter Institute for Caregivers. We're an organization started 35 years ago by Mrs. Carter before caregivers were even a trendy word like it is today. And I think it speaks to her long focus on supporting and caring for those amongst us. The Institute is focused on strengthening the health and resilience of family caregivers, who we define as family, friends, neighbors, ex-wives, ex-husbands, whatever that relationship looks like. And my personal tie to caregiving is why I'm in this role. My parents were both caring for family members that they loved, and I saw the impacts on their physical and mental health in that journey. And as an epidemiologist by training, I wanted to know why that was the case and how I could reduce it. And so, as some of you may know, I've been living in Plains, working for the Institute ever since.
Wonderful. And welcome, Jennifer. Kathleen, let's start with you and setting the stage with the national perspective, if we can. What are some of the important federal policy discussionings happening now that will impact caregiving?
Mm-hmm. Well, I'm really happy to report that there are a lot of activities happening in Washington, D.C. related to behavioral health policy, both mental health and substance use disorders. And really, you know, all of these discussions impact caregivers in one way or another, whether it's a caregiver caring for an older adult with depression, anxiety, or serious mental illness or dementia, or, you know, a parent caring for a young child. All of these, you know, across the lifespan, they're all being addressed right now on Capitol Hill. So I'm really, really excited to report on a lot that's happening. And coincidentally, as we speak this morning, the Senate Special Committee on Aging is holding a hearing on mental health and aging. There are 4 witnesses that are speaking, including the mental health director from the state of South Carolina, who's talking about the issues from his perspective. The executive director of Vibrant Emotional Health, who is going to be leading the new 988 Lifeline, Suicide Prevention Lifeline, and also the lead for the SAMHSA-funded Mental Health and Aging Center of Excellence at Rush University Medical Center. So this hearing is really a great step forward in identifying, you know, where we need to go. It is being recorded, so those of you who aren't able to join, you'll be able to listen to the recording. Also on the Senate side, I wanted to also talk about that the Senate Finance Committee has focused on mental health. Last year, they issued a request for information on mental health, again, across the lifespan, including addressing the needs of caregivers. And they asked for information really looking at some key issues: strengthening the workforce, increasing integration, coordination, access to care, ensuring parity between physical and behavioral health, and furthering the use of telemental health. So they got a tremendous amount of response to that RFI. They held a hearing in February of this year, and they're currently putting together a legislative package to address all of those issues and to incorporate what they heard in response to the RFI, what they heard at the hearing. In addition, many of you may have heard in the President's State of the Union address in March, he announced a national strategy to address the mental health crisis that's currently happening in this country. And his priorities were, you know, somewhat similar to those that I just mentioned that the Senate is focusing on: strengthening system capacity, connecting Americans to care, and supporting Americans by creating healthy environments. And if we have some time, I can go into more detail about that. But we're really excited because, you know, what he is proposing in his budget really, I think, aligns well with what not only the Senate's working on, but also on the House side, there's a lot of activity. And there are many pieces of legislation that have already been introduced, including the Mental Health Access Improvement Act, that would increase the types of providers that can be reimbursed under Medicare, such as marriage and family therapists, mental health counselors. There's also the promoting effective and empowering recovery services that's supporting peer support, counselors who can work with older adults and others. There's the collaborate in an orderly and cohesive manner. That's a bipartisan bill that would expand access to evidence-based mental health and substance use care by investing in better integration of primary care and mental health. There's a number of other pieces of legislation that are moving forward. So there's going to be a lot happening, I think, particularly in an election year. The public wants to see improvements in these things. So I'm hopeful that some of this will get passed. We work incrementally in this country, so I think it'll be over the course of the next several years where we'll really see improvements.
Great. Thank you. Thank you, Kathleen. As we mentioned in our prior panel, really gives hope to parents and caregivers of all types, if those that their loved ones can get the mental health services that they need. And also for caregivers themselves who have a greater rate of depression and anxiety to be able to get the services that they need. Shifting a little bit, Jennifer, can you share with us what you're seeing and hearing from Georgia caregivers across the lifespan?
Sure. So before the pandemic, recent estimates showed that 1 in 5 adults in Georgia were caring for an adult or child with special medical needs. And we can only imagine that that number is, I'm sure, far greater now. And what does that look like? It means that caregivers are experiencing all the stresses and burdens that we've talked about that we all experienced during COVID, and they're dealing with their caregiver responsibilities, which any of us who have been in that role know are complicated. We did some work early in the pandemic, and 83% of caregivers said that their stress level and their concerns about their own well-being, as well as the well-being of the person they're caring for, were at stake. What we recently have been doing, though, is talking to the area agencies on aging and some of our partners here in the state about what is the kind of driver of a lot of the challenges caregivers are facing. And one of the biggest issues is the shortage of paid care workers, which wouldn't be a surprise when we think about care worker burnout and challenges related to compensation. And how that matters to the family caregiver is it means it's either impossible to find or impossible to afford that person who can come in and do some of the medical and supportive tasks, or even sit with a person so that the caregiver can go out for a walk or their own medical appointment. I think when I hear Kathleen talk about all the opportunities of change for supporting mental health transformation, I think how that's going to support the caregiver's mental health, because they're going to get ideally access to improved services and better coordination between their physical and mental health, as well as to reduce some of the complications that they experience in that care coordination that they do and spend a lot of time and stress dealing with, as well as things we're seeing tied to stresses in the state around medical billing, some of the complexities of regulation changes when services become unavailable. And so all of that is driving challenges within the state. The other category of concern is around the challenges for caregivers with identifying or even locating caregiver support services. We often think about caregiver support services based on the condition of the person you're caring for. And so how do you find, if you're a 25-year-old, are you thinking about going to your area agency on aging for support with your aging loved one? Maybe not. And so I think there's just a challenge about navigating, if there are services, where those are and what they look like. And despite our best Googling, we may not find those solutions very easily. And so both kind of locating services and affording services.
Yeah. Jennifer, you've educated me over the years in working with you that you think about caregiver supports, and it's the supports that the person that's being taken care of needs. But thinking about the supports that a caregiver needs, and sometimes it's not, you mentioned it, getting someone to come in and sit for you, but it can be also other things like how do you get the groceries bought? How do you get the bills paid? How do you get the laundry done? How do you get the dog walked? You know, all of these, or how do you get the children taken care of when you're taking care of an elderly parent and it's just a different. I think, as I mentioned in my opening comments, we're all dealing with a different layer of complexity after the last 2 years. And I think grief is something that many of us are experiencing in a very different way, not just the loss of loved ones, although over 1 million people have exponentially have lost ones because of COVID, but we've also experiencing grief and loss of lifestyle and things like that. And that's tough, being a caregiver when you're also dealing with your own lean emotional bandwidth, speaking personally. Tony, how in your research have you seen bereavement impacting those who work kind of in the care industry, if you will, not family caregivers, but just the care industry?
Well, first, let me say, bereavement touches everyone. So Eve, thank you for that. And just to be clear, bereavement means just the fact of loss or death. Now, in the work that I'm doing, I'm focused on deaths, but bereavement actually begins before that event, particularly when you have someone who's losing cognitive or physical function. So you are absolutely spot on with that. So I have 2 projects that I think all Georgians should be very much aware of. One of them involves professional caregivers working in long-term care. The other one involves a statewide assessment of the prevalence of bereavement. We started that assessment before COVID. We are the only state in the United States that has that kind of data, and other advocacy groups have been working to obtain more funding, federal funding, to support the CDC and the states as they do what they call the Behavioral Risk Factor Surveillance Survey, or BRFS for short. So let me start first with the work that we've been doing in long-term care centers. The Georgia Department of Healthcare Facilities Regulation has a fund called the Civil Monetary Penalty Reinvestment Program, which is a mouthful. And I've written about it. So if you Google my name, you'll find a paper that explains that. But what it does, it provides a pot of money for each individual building to improve their care. And one of the things I was able to convince the state was that bereavement care for people who work in those spaces is non-existent. And so we started back in 2016. We traveled the state. We interviewed professional caregivers who work multiple shifts. We interviewed residents, we interviewed families, we interviewed everybody in the building, because if you've seen one long-term care facility, you've seen one. Each of them is different and unique in their own way. So we took all of those interviews and created a series of guides, a toolkit called Best Practices in Bereavement Care. And now, during the pandemic, before the pandemic started, we were supposed to go out and start training people in these practices. Of course, the pandemic closed off access for us live. But with the advent of telehealth, we were able to flip to doing webinars. And so we've probably given the toolkit out to about 4,000 people across the state. There's a staff guide, there's a resident and family guide, and there's a guide for the communities around these buildings, because bereavement is huge. And it's not just, you can care for yourself, but also others around you have to help you in that recovery process. So we were very blessed to get that project going. But what it taught us was that there's a larger number of people who are not touched by that environment who are also bereaved. And so in 2020, we got the data back. And now we know that 45%, almost 46% of Georgians 18 and older were newly bereaved in the 2-year period before 2019. That's 4 million people. And we're talking about people, of course, older adults. We're also talking about people who are teens or young adults. And one of the things we learned from that survey is that the highest rate of bereavement is from people who are caregivers, which should not be a surprise to any of us. But the larger, I'm telling you, I give these talks now and everyone's like, why are 35-year-olds bereaved? Well, it's because they've been caring for people who are really, really, really quite fragile. And when those people die, they are bereaved. And so now we're writing papers on the health effects of exposure to bereavement, and we're using the advice we got from professional caregivers to help manage bereavement. So I'm very, very excited about both of those projects.
Great. And Tony, did you say that Georgia is one of the only states that is collecting this data around?
Right now, we're the only one who knows that about our state. We've been...
Go Georgia.
Go Georgia. I'm telling you, there's a group. If you want to see the advocacy group that's been operating on the federal level is called Evermore. And if you look at YouTube, you'll see a channel of a symposium that we did on this topic.
Mm-hmm.
So they've been instrumental in getting those extra funds for states to measure it themselves. And so now that we've gotten the funds in the last appropriations bill, now we have to convince the states, yeah, you need to do this. And Georgia is leading the way on this one. So go us.
Great. If you could put in the chat, Tony, like that organization that's led that effort nationally, I think people would like to follow up on that. And also, yeah, that would be really helpful. Kathleen, tell us what the work of NCOA is in this space right now. Oh, you're on mute.
Yeah, thank you. Thank you, Eve, for the opportunity to share a little bit more about the work that we do at the National Council on Aging. For those of you who might not be aware, NCOA is the oldest national organization dedicated to improving the lives of older adults. We've been around since 1950, and we were involved in early discussions around retirement security, helped develop Meals on Wheels program. I have done a lot of things over the years. We've evolved quite a bit, since the early days, but our mission currently is to improve the lives of millions of older adults. And we really focus on those who are struggling, those who are low income, those who live in underserved communities. And we truly believe in a just and caring society in which each of us as we age lives with dignity, purpose, and security. And we have, some key target populations that we tend to focus on, and caregivers is one of those populations. And we measure everything that we do. We have a very solid kind of impact goal, and that is to reach 40 million older adults by 2030. And we're well on our way to reaching that goal through the various programs that I'll talk about. And the work that we do really is around developing resources for the aging network, for the healthcare community, for the mental health community, anyone who touches the lives of older adults. The work that I do at the Center for Healthy Aging, as I mentioned, is focused on health promotion and disease prevention programs. And many of them address the needs of caregivers. We have the national database for these programs, and we actually are able to measure whether or not someone who goes through these programs is a caregiver. And we're seeing, about 20% of people who go through the programs, like chronic disease self-management education programs to help a caregiver manage a chronic illness for themselves, like, diabetes, heart disease, arthritis could be a mental health condition, or they're helping to manage a chronic condition of the care recipient. We also promote falls prevention programs, physical activity programs, and a range of behavioral health programs like Pearls, Healthy Ideas, which is specific for helping older adults address depression management. And they work in conjunction with healthcare providers as well. We also are trying to get more of the aging network to implement strategy like screening, brief intervention, and referral to treatment around substance misuse and abuse. And a report just came out. We're seeing huge increases in overdose deaths among older adults. So we've got to do a better job of identifying people at risk before they get to that point. So we also have a number of tools that we have developed. One that I want to point out is our benefits checkup. It's an online tool. Older adults, caregivers, persons with disabilities can go to find out what benefits they're eligible for. And these could be benefits at the federal level, state, or local level. And so things like SNAP benefits, they can find out about whether or not they're eligible, and they can start the application process if they are eligible. They can find out about the low-income protections in Medicare. So if they need help paying for, the premiums, the co-payments, those sorts of things, they can find out information about those through the benefits checkup. They can find out about local housing subsidies or low-income heating assistance that might be available in their community. So that's a really great tool. And then another major area of work that we do is advocacy on Capitol Hill, protecting programs like Medicare, Medicaid, the Older Americans Act, that's so important for older adults and their caregivers. And one thing that I didn't mention is we work quite a bit on securing additional funding for the Older Americans Act that supports the local community services, transportation, meals, the evidence-based programs that I talked about. And we are pushing hard to get expanded funding for all of those programs that we know were so critical during the pandemic. And, the need is really significant. Related to the work that we do around economic security and benefits access, we also fund benefits enrollment centers at the local level. So these are actually physical places where older adults and caregivers can go to find out what benefits they are. They can receive counseling on benefits as well as making decisions on like Medicare options that they might have, whether it's, to stick to Medicare fee-for-service, go to a Medicare Advantage, and to find out like which Medicare Advantage plan is best for them. In Georgia, we have funded at least 2 of these benefits enrollment centers, one through the Georgia Legal Services Program, and then the Atlanta Community Food Bank. So again, these are free services that those in Georgia can go to. And we have a list of all the benefits enrollment centers on our website. Another major area of work that we support at NCOA is senior centers. So we house the National Institute of Senior Centers, and we have for the past 50 years. And right now we are working with senior centers across the country to help them become modern. So much has changed over the last 2 years for the pandemic. 95% of them had to shut their doors because of the pandemic. They're slowly kind of ramping up, opening up, figuring out how they're going to deliver services to older adults in the long run. And I really see, part of being modern is to address the needs of kind of multiple generations almost, and what we see 65 plus, because we could have, a 70-year-old caring for a 95-year-old parent and they need respite. And senior centers could be a place for that respite. And perhaps they have, an adult day plus a senior center. We're seeing more of kind of those multiple service delivery systems within a senior center setting. So just wanted to mention that work. We just received a grant from the Administration for Community Living to look at what it means to be a modern senior center, and then to develop resources, tools, and provide technical assistance to help the senior center network across the country to do so. So so those are some of our areas. I welcome you all to visit our website, ncoa.org, to learn more about our organization, and I'd be happy to answer any questions at the end about the work that we do. But again, we really focus on healthy aging and economic security. We really take a holistic approach and feel the two of those really are the foundation for quality of life for older adults and their caregivers.
Wonderful. Thank you. Jennifer, have you, are you recently seen policy changes nationally and in Georgia that are directly benefiting caregivers?
I think one of the most promising opportunities at the federal level that will impact states and other sectors is the Raise Family Caregiver Act. There is a intention for a nationwide strategy to support caregivers, and that's across the lifespan and includes grandparents and kinship care. It includes parents caring for children with special medical needs and all of the other caregiver experiences that we have been talking about today. And that will include a set of recommendations for states as part of that work. And so I'm really excited for states to have a bit of a roadmap that is both customizable in the sense, right, that states can pick what they can do, but will also be opportunities for shared learning from state to state. So we've been looking at what's happening in a few states where caregiver supports are unique. One of those is Hawaii. They have a program where caregivers get funding who are in the workforce so that they can stay in the workforce. It's a small amount of money, but these are the types of programs that we'd like to see. And with that set of recommendations and strategy direction, as well as that cross-state learning, I think there'll be some opportunities. Second, with the CARES Act, through the pandemic period, there's been opportunities for additional funding for caregiver supports. And again, different states are taking that funding and using it for, as Kathy mentioned, evidence-based program delivery, but also looking at how they can change some of their data collection systems to find out where the caregivers are in their state, or looking at opportunities to link caregiver support to other programs to make it more convenient. You know, you don't want a caregiver to have to go to a class that's at one location and the day center is at the senior center. Like, how can some of that be brought together? And how can states look at caregiver health through a variety of lenses, through their Department of Labor, through finance issues, through public health. And lastly, and probably the most exciting thing for Georgia caregivers, is the recent passage at the state level of the Georgia Caregivers Act because of significant work by AARP. AARP has been focusing state by state at improving the ability and knowledge of, or improving the opportunity for hospital systems and healthcare systems to identify a caregiver at the time that a person is admitted to the hospital, telling the caregiver when the person's going to be discharged, because we've often all heard and can think of stories where somebody gets a phone call saying, your loved one is at the door, ready to come home, often with a bag of medication and a list of instructions and very little other supports. This Georgia Act will enable, or will require, that the hospital system does live training of caregivers for medical and nursing tasks. And we continue to see that more and more tasks are being put on the family caregiver, whether that's changing an IV or feeding tube activities, a variety of more and more medical efforts. And so the idea that family caregivers will get that training is critical. I hope will have huge impacts on some of the stress and anxiety. I think a lot of work has shown that many caregivers fear making a mistake on something to which they haven't been trained. You know, the person who was doing this for their family member in the hospital had gone to school for years, had seen this procedure been done. A family caregiver who's struggling with sleep, with their own finance issues, and tried to watch a video on YouTube or listen to some friend tell them what to do is incredibly complicated. So it's huge. It's huge for Georgia and starts July 1st. So I'm really optimistic about that.
Yeah, I really look forward to seeing how that pans out. I mean, as a caregiver of mother who was chronically ill, it was once you learned a task, you were on your own, and God forbid you'd want to go on, you know, a 3-day weekend with your grandchildren somewhere. You know, the home health agency would say, no, you've been taught to that. You taught that. You need to keep doing that. Yeah. So a little bit of respite in there is greatly appreciated, and it doesn't make sense when the professional caregivers are making their way through the building anyway, but yeah, so wouldn't even allow us to pay it out of pocket. So very strange, very strange.
Wow.
So Kathleen, what should we be advocating for next to support caregivers?
Well, I'm
Big question.
yeah, I know. I'm really glad, Jennifer, you know, you brought up the Raise Family Caregiver Act. And I, you know, was so excited when the Advisory Council for the Raise Family Caregiver Act issued their report. I think it was in September. And really lays out what's needed for caregivers. It's a comprehensive report. I think there are like 126 recommendations in that report that address increased awareness of family caregiving, looks at emphasis on integrating caregivers into the processes of care, which I think, Georgia, you're way ahead. You've passed that law that will get started very soon, so that caregivers have the skills that they need to do the more medical tasks that they're now being counted upon to do in the home. Increase access to services and supports to assist family caregivers, increase financial and workplace protections for caregivers, and then better and more consistent research and data collection on the needs of caregivers so that we can better address what those needs are in a more real time, I think. So we need to advocate that these recommendations get put into legislation and that they get fully funded. You know, some of this might be part of, you know, what the Administration for Community Living does. Others may be part of things that, you know, Medicare and Medicaid could support through different flexibilities in their systems. Like Medicaid waivers could support, you know, some of the training that might be needed for caregivers so that those medical tasks can be conducted appropriately. So I think there's definitely a lot of opportunities. I'd love to see, you know, like SAMHSA, the Substance Abuse Mental Health Services Administration, address more of the needs of caregivers, particularly those that are experiencing depression, anxiety, and other conditions because of their caregiving journey. So those are just, you know, some ideas, and I, you know, would recommend that, you know, you all, you know, take a look, because the report is really, really terrific. And I don't know, Jennifer, are you part of the advisory committee? Or do you have really good, I'm sure you have really great connections to the members of the advisory committee, because I think what you're doing in Georgia, they need to know about is, you know, a model for what some other states could do. So I agree. I think that the sharing across states is vitally important in order to continue to better meet the needs of caregivers.
So we need to advocate for this legislation, but we also as advocates need to make sure that it's implemented as well. Jennifer, do you have any recommendations as to how advocates might be able to focus their advocacy work or track this? Is there some, I might be putting you a little bit on the spot here, but if we've seen where this coalition building in other areas has really held our policymakers and agencies accountable. And we're collecting the data thanks to Tony, but we need to also make sure that as a community, we get this enforced.
Yeah, I think one of the biggest opportunities is related to hospital or facility accreditation, getting caregiver education to be part of the accreditation list, right? So when those inspectors go out, that they're asking, how are you implementing, making sure these caregivers get trained? What does that look like? Who is involved in that? And I think that's an opportunity. I think the other is to figure out ways to bring this question and many others to the governor's race over the next few months. I'd love to see conversations and even commitments about how some of these things are going to be implemented, because I think it's a long path, right? July 1st is the official date, but as I know the mental health community has seen, it takes a bit longer than that clock striking midnight for that action to happen. And the other thing is around quality assessments that caregivers do. Usually when those surveys get sent to households about the experience at the hospital, it's often the caregiver that's filling that out. And so how can some of that accreditation, those star ratings, which lead to reimbursement levels, be tied to caregiver support and caregiver experience?
Yeah, great suggestions.
Yeah.
Perfect. Tony, what are the policy implications of your research nationally and here in Georgia?
Oh my, we need to see, number one, what we've been advocating for in addition to the data collection, because we really need to see who's bereaved. We count the dead. There are 1 million people who died just of COVID. And there are 9 individuals estimated to be connected to that one person. That's nationally. But people continue to develop Alzheimer's or to need care before they died, and there was other causes. And so we really need to see who's bereaved and what they need. What I've been, by the way, I just want to let people know, I put a couple of files in the chat. One is a description of the Civil Monetary Penalty Reinvestment Fund. That is one way you can get your local long-term care facilities to request money from the state. It's a pot of money that's there. You don't have to get legislation passed to get it, and it can help improve the quality right away in your target buildings. The other is a set of slides that I put together to illustrate what we can do with the data that we collect. One of the things we have started to focus on is the effect that bereavement has on risk for binge drinking. And it turns out that it is the younger distribution of the population that is most likely to binge drink after a loss. And so not only should we have some policies around that, and they're outlined in some of the papers we're writing, but individuals can work with their friends to, if they spot this kind of behavior, to help them ease back. I got multiple reports from people who work professionally, who normally don't drink a lot, that they engaged in binge drinking, and that's 4 or more drinks in a single 2 to 3 hour period. So we can start by helping one another. And then as we get bigger and more engaged with one another, we could take that energy to our local city councils. I mean, I live in Athens, and we're doing stuff here in Athens. We have an Athens area grief group. That's what we call ourselves. So there's a lot to be done on multiple levels.
Great, thank you. Kathleen, did you want to say something?
Yeah, I just wanted to also add, I definitely, agree with with what Jennifer was talking about and Tony, how, data is so important. I also think we need to tell our stories to local decision makers, state-based and federal decision makers, to really highlight the impact, that these issues are having on the lives of care recipients and caregivers. That it's vitally, vitally important. And that's something we're doing more and more of in our advocacy efforts at the National Council on Aging. So collect stories, do what you can when you are engaged in advocacy efforts. Yeah. Although it was an advocacy effort earlier this week, NCOA hosted the Older Adult Mental Health Awareness Day event. It's a national recognition of the needs of older adults, mental health needs. And we had 9 sessions throughout the day. It was a virtual conference such like this one. Every session we had an older adult or a caregiver talk about their personal experience, whether it was with suicide, caregiving during the pandemic, and the grief that they experienced after losing someone during the pandemic. Just a really wonderful way to highlight the needs. So
really, really good point. Our legislators that participated in our earlier discussions yesterday and today kept emphasizing that the importance of storytelling and relating to each other as humans is so important, really. Jennifer, what system and structural changes are needed for caregivers, and who needs to be at that table?
Sure. I mean, I'll start with a question. If we were in a live room, I'd ask people to, raise their hand if when they go to the doctor, they are asked about their behavior related to smoking. It's probably most of us. Drinking. It's probably most of us. Depression screening probably depends on where you live and what kind of provider you have. Mm-hmm. If you're caring for anyone if you have any caregiving responsibilities, I'd go with no hands probably being raised. Mm-hmm. So while we know, and we've talked about today, the impacts of caregiving on physical and mental health, we don't actually ask any questions about that. The act that I talked about even, that just passed is focused on asking the person who's in the hospital bed who's caring for them. But I remind myself that there's a number of people who are laying in hospital and long-term care settings right now who are indeed caring for someone else or have been in that caregiving role. And so I think there's kind of opportunities at that healthcare system and structure level. But there's also opportunities at the employer level. In public health, we often say we want to support someone where they live, work, play, and pray. And so where you work and how caregiver supports are available or not available impacts opportunities, both for your own economic well-being, as well as how your workplace is part of your stress and environment. And so employers can look at their policies right now that they have in place from a parity lens. If you're offering these benefits to new parents or to people who have a certain type of diagnosis, is that applicable across all types of caregiving responsibilities? Is that applicable for all sorts of friend and family relationships, especially as we know people have greater numbers of chosen family that they're in a caregiver role for? And how are you making sure that those benefits are actually easy to identify in your benefit system, not buried? Because one thing that caregivers definitely don't have is time. So how are you making that easier? And then how are you thinking about workplace culture? In the mental health space, there's a lot of conversation, rightly so, around stigma. I'd suggest there's also caregiver stigma. People don't want to admit or talk about their caregiver role. But I'd say where the biggest kind of stigma overlap is people who are caring for someone with mental illness. Mm-hmm. And in some parts of the caregiver community, there's some snarky remarks at times about the cancer casserole, that once you tell someone that you are caring for someone with a condition like cancer, a meal train is set up or some other things are done. Mm-hmm. But how often is somebody going to go to their employer and say, I am supporting my sister with substance abuse issues, and how open is your work environment at the supervisor and manager level for those conversations to happen? Mm-hmm. And so I think there's just kind of things that are various systems and structures make it harder for us to both support caregivers and to think about how to reduce the burdens that we've put in place because of kind of structures or lists of qualifications.
Yeah, another structural change is we kind of went through this huge pendulum in the mental health community, giving rights to individuals with mental illness, but then excluding caregivers from that. So that kind of system of care, if you will, and that is sometimes a real challenge to find. There needs to be the autonomy of the individual, the consumer, but there also needs to be reinforcements for that family structure, I think, as well, and those caregivers specifically. I see this very much in the geriatric community. Go ahead, Tony.
Yeah, I just wanted to amplify Jennifer's message. One of the things, I'm a firm believer in early prevention action. And one of the things we've initiated in our household is neither one of us goes to the doctor without someone else being present in the room. Doctor likes it because you got two sets of ears listening. You're not under the duress of an emerging illness, and it starts to build a relationship. So one of the things I've been advocating to all my friends and family is that pick a person who can go and hear what's going on, because that person will ultimately become a caregiver, or you might become a caregiver for them. It is, all of these messages say caregiving. I can't do it any more eloquently than Rosalynn Carter has done it. You get the idea, and that's where it starts, I think.
Yeah. We're limited time here, but I'd like to kind of end on looking at how our COVID experience, how did that change our efforts to advocate for caregivers?
Well, I'll just add one quick comment on that. I see more support now for caregivers because everyone feels like they've been boxed in, and we have. And so, I've seen flourishing of Zoom conferences, family FaceTime. People understand now in a way they never did before that you're stuck in your house and you have needs, and they do too. So I'm very optimistic about that.
Yeah, I've seen through Emory and the Carter Center a real opening up of benefits and understanding more so of what caregivers are up against because of COVID. I would venture to say that caregivers have been up against a lot of these things before, but COVID has made us more aware of the fact that people are challenged with their caregiving responsibilities and their work responsibilities and that kind of thing. Jennifer, Kathleen, do you have things you would like to add?
I'm thinking of a military caregiver that we have spoken to a great deal in our work, and she said she's caring for someone who's immune compromised, and she said, this is the opportunity for the world to be welcomed into our world, to understand, and so I think she was very eloquent in describing all of those things that other people take for granted, the ability to go visit people or to go pick things up at the store easily or to do was restricted in various ways. So perhaps this is an opportunity for more collective empathy and awareness that will transform all of our thinking, policymaker to individual.
Yeah.
Yeah, just to add on, I love that collective empathy for the caregiver. Yeah, absolutely. Yeah, one of the things that we definitely saw during the pandemic is, I talked earlier about the evidence-based programs that we help to support. Well, we really work very closely with organizations all across the country to move these programs from in-person delivery. Most of them were, delivered in healthcare settings. They were delivered in senior centers, faith-based organizations, libraries, you name it. Well, we couldn't do that anymore. So they moved to using virtual platforms and did it pretty quickly. And what we're finding is that a lot of these organizations were able to reach many more people as a result, including caregivers who were not able to leave their home because they had caregiving responsibility and couldn't go to a local community-based organization to join a program to help them manage a chronic illness or help them prevent falls in the home. So it was really great to see, and we did see, caregivers and their care recipients join programs together and learn together, which was great. And that's, I think, is going to continue. That's not going to go away. So we're going to be able to reach many more people. And also these community-based organizations, I think, started working with many more partners too throughout the community. And those partnerships are going to continue to be leveraged well beyond the evolution of the pandemic. And we also saw huge increases in calls for benefits access, particularly around food and housing. And that hasn't ended, particularly now that food prices have increased so dramatically.
So with this crisis, there's definitely some opportunity, and I think we're going after that opportunity. And with that opportunity, I think there's hope for caregivers that things will get easier in getting the services that they need for their loved ones, but also the supports that they need as caregivers. I'd like to shift a little bit now and share with you a video clip from an 11 Alive interview with State Representative Todd Jones and his wife. Representative Jones was a co-sponsor of the Mental Health Parity Act that passed this year in Georgia. It is a bill that will give hope to many caregivers and parents that their insurance will cover the medically necessary behavioral health treatment and care that their children need. After the video, please come right back because we'll have closing remarks from our panel. Please also remember to post your questions in the chat. Brandon, can you show that video, please?
Justin spent 6 years in psychosis. Many of those years misdiagnosed, medicated with the wrong drugs.
One of the side effects of schizoaffect is bad hygiene. And I said, son, let's go take a shower. Oh, Dad, I can't. The razor blades are coming out of the shower head.
Personal experience with our failing mental health system has also given Todd the passion and a purpose to speak as a father and a lawmaker.
Our challenge today should not be, can we cure mental illness? Can we cure substance abuse? Rather, our challenge is, can we at least start?
As a state representative, Todd Jones has worked with Mary Margaret Oliver to present the Mental Health Parity Act. At its core is a requirement that health insurers cover mental and medical treatment equally.
If there's no limits on physical health doctor's visits, well, then there's no limits on mental health doctor visits.
The bill defines medical necessity, the standard by which insurers are held accountable. And for those companies administering Medicaid, 85 cents of every dollar must be spent on patient care.
We understand there's administrative costs. We're not blind to that, but we definitely don't want 83 or 82, which is where they're at right now.
That extra 3 cents for every dollar really make that much difference?
Oh yeah, that extra 3 cents based on last year's spend comes close to $500 million.
Todd hopes all of these changes, if passed, will give people like his son treatment earlier and longer. The Jones shared with the Reveal a list of all the places Justin has received care. 4 states, more than 20 different facilities. So some people would look at that and say, he got a lot of care. I mean, What is it that the two of you want?
Exactly. That's what you'd think.
Well, I still remember walking in, he's banging his head against the wall, blood's coming down, and we walk out, and they literally say to us, oh, looks like he's ready to step down soon.
Yeah.
And you're like, I'm like, have you been in that room lately?
The Joneses say what their son got was a repeated cycle of short-term stabilization with no follow-through for a long-term solution.
It's almost like a community developer building 1/10 of every house. You may have poured the concrete on the house, but you never built the walls, you never put in the conduit, you never did anything to let someone live in that home. Well, it's no different.
For periods of time, Justin was homeless. Not truly understanding his illness, he would run away. And each time, Todd and Tracy went looking.
His hair had grown completely out, complete beard, nails were, literally out to here. And he didn't want our help.
No.
He pretty much was like, if you could just buy me a sandwich, I'll be okay. Yeah. And of course, We bought him the sandwich. Remember the burrito? It's the only thing we could find.
Todd and Tracy say the only reason their son is stable now is because he broke the law. It sounds absurd, especially when you think about it in relation to another illness like cancer.
Yeah, we can't give you the treatment you need for your stage 3 breast cancer. But if you know what, if you go and rob over there, we can get you into a facility.
Thank you, Rebecca Lundstrom of 11 Alive, for providing that clip. We sincerely hope that the Mental Health Parity Act gives parents like the Jones hope. Clearly, the Jones could have benefited from some additional supports as well as they navigated caring for their ill son. So my closing question to the panel, and I want to thank you all for your time and the good work that you're doing. What brings you hope for all caregivers in Georgia? Who'd like to kick it off? Kathleen, I'll start with you.
Well, what gives me hope for Georgia caregivers is that I really feel Georgia is leading the way. You are serving as a model for other states and some of the, not only the parity legislation, which is really critical, but the caregiver supports that Jennifer spoke about earlier. And I think with what's happening at the national level, there's lots to build on. I think we're going to see more funding to support caregivers, the range of services. We're going to see greater enforcement of parity that can augment what you're doing already in the state. There's a parity bill that's moving forward around Medicare, because Medicare was carved out of the national parity laws when they were passed. And there are so many limitations on, for example, the number of visits that an older adult can have for serious mental illness, for example. So I think there's tremendous hope coming within your state and from the national perspective on supporting caregivers.
Great, thank you. Tony, what brings you hope for Georgia caregivers?
I think that being able to see them. I mean, I tell my students, if people turn purple tomorrow, there would be a lot of purple people. And I think what we're doing and what Jennifer and the Carter Center is doing is shining a light on that in a way that folks were like this before. So being seen means we can say how many people need services, how many people are getting what they need, and sharing best practices, because the problem is too big for one group to grapple with. We have to work together on this, and seeing that gives me a lot of optimism.
Right. Jennifer, can you wind us up?
I think, Eve, for me, it's the idea that we are integrating these two areas, which Mrs. Carter has been working on for decades, but which are often siloed. The idea that those with mental illness have a caregiver has been known, families have been supported, but there are so many opportunities, and recognizing that caregivers are at risk for mental illness. They themselves are struggling with mental illness. They could become a caregiver while they're in the midst of their own struggles, and that we can't look at these issues as kind of independent on a policy document or independent in our program delivery, but to work together.
Great. Thank you all. I really appreciate you taking time out of your busy schedules to join us today and share your perspectives, share with us where we should be focusing our efforts, action plans. So thank you so very much. All right. Now I want to, in concluding our 26th Georgia Mental Health Forum, I want to thank everybody in attendance. We appreciate your input. We hope so much that you thoroughly enjoyed the Rosalynn Carter Mental Health Forum for this year. We would like to be in person, but we also realize that when we do this virtually, we are able to reach more people, and that's so very important to us. We want everybody in Georgia to be able to participate in the forum. We hope that you're leaving this event with new learnings and inspiration, and that you'll continue to make this year, but I think we've changed it now, this decade of mental health in Georgia. We want to hear your feedback on your experience over the last 2 days. We take that seriously and we make adjustments. We will be sending out a short survey, and if you could please just take 5 minutes to complete it, we would greatly appreciate it. We want this to continue to be a meaningful activity for you each year. I want to remind you that a recording will be placed on the website in about a week. And I'll conclude by, again, thanking you for joining us. And also, we couldn't do what we do without our very generous and highly engaged donors. And we want to thank you very much for their contributions. Take care of yourselves. We'll see you soon. Thank you for joining us for the Georgia Forum.